What I would like to put together is we would like to come up with the proceedings of this meeting. So these proceedings will highlight the summary of the clinical presentations from this morning, the safety aspects that has been discussed, and summary of the discussions of the tracks that has been presented this afternoon. And we're hoping to have this published in JUM, Journal of Ultrasound in Medicine. I haven't talked to the editor, but I'm sure he would be open to that. So then, from the discussions of the tracks, I think certainly there's a strong need to have patient advocacy representation, patient advocacy, whether it's a committee that we will create or a group, either within the AIUM or multi-organization that would work towards enhancing the concept of ultrasound and ultrasound first with our patient advocacy friends here. And I think that's certainly there's a deficiency on our part in the healthcare worlds and the healthcare industry with regards to that. And I think that's an area that we certainly need to address and has been highlighted very well in track 1. We have to work towards more collaborative relationship with our insurance providers. I think that has been shown clearly during discussions in this morning and certainly in track 2. And I think we need to, as we develop guidelines or as we work towards looking at ways to enhance the concept of ultrasound first, we have to work more collaboratively, whether in looking at low-hanging fruits that we work together or in looking at development of guidelines in the future. We have to sit at the table at the outset, and I think that is so critical for us to work towards in the future. I think there's no question that societies have to work towards enhancing education and quality in ultrasound. I think there's some deficiencies that have been identified today, as you've heard this morning, whether this is in accreditation or whether through web education, through more education through residency programs and so forth, but certainly there's a strong need for societies. Societies and residency programs and so forth are a great aspect for this. I wanted to highlight that in our Journal of Ultrasound in Medicine, we started a series of articles called Sound Judgment. We have put a journal in your syllabus material that highlights some of these articles. These focus on the concept of ultrasound first, that areas, clinical vignettes that really address this issue. As Dan has mentioned, I think it's important to start with low-hanging fruits. He identified, their track identified some related to gynecology, postmenopausal bleeding, 3D ultrasound in Mullerian anomalies, guidance in vascular access, and there are many others I think that has been identified. If there is strong evidence to really show comparative effectiveness, I think development of guidelines, working collaboratively with insurance company, I think starts setting the pace for the collaborative work that needs to be done towards these issues. There's certainly tremendous benefit from expanding the educational base, as has been highlighted in the second track, especially in the medical training and medical education. And addressing this at the medical student level, I think would set the pace long-term for the role of ultrasound and expanding the use of ultrasound and ultrasound first. And I think this is an area that SASMI had worked on very nicely, and AIUM had been a great partner on that regard. I think as we heard from the third track, we have to keep the message very simple, concise. We have to target specific audience towards that regard. And I think working collaboratively with marketing to really set the message would be very helpful in that aspect. And certainly working with industry to reduce the technical barrier to the ultrasound equipment, maybe standardization of the interface if possible, consistency in use, and maybe 3D ultrasound making it more automated and less user independent would really open the door for simplification of the study and making it more like CT and MR and less user dependent, because that would help in making ultrasound more user friendly. So with these remarks, probably the path for the future, maybe putting a steering committee together from this event and starting to working towards putting some pieces together for the future, maybe identifying some areas where we can start putting some guidelines and developing all the education and training and patient advocacy. And I think if we focus the message on areas where we think we can get benefit and returns on the message very quickly, I believe we can start charting for the future. Okay, well, I would like to thank you again very much for your dedication and your being here, and have a safe travel, and you will hear more for us. And thank you for supporting the concept of ultrasound first. Thank you.